Almost 2,200 dental patients made complaints to the GDC last year, an increase of 44% on the previous year. 33 dental professionals were also struck off following investigations. Now, the General Dental Council has updated its standards guidance, which sets out for dental professionals the standard of care patients expect. At the centre of these standards are some core ethical principles, which all registered dental professionals must keep to at all times. These include putting patients' interests first, effective communication, and having a clear complaints procedure in place.
I think it's very important that the standards that apply to any profession reflect the current state of patients' expectations, and expectations change over time, and therefore the standards need to change accordingly. So over the last 2 years, the General Dental Council did a lot of work with patients and the public to try and get at the bottom of what their expectations were when they go along to seek dental treatment. And we used that information to amend our existing standards. And I think we've ended up with much clearer standards, clearer for dentists and dental care professionals, but most importantly, clearer for patients and the public. Amongst the key principles in the standards is the importance of good communication. We're asking dentists and dental care professionals to communicate as effectively as possible with patients, so that patients know the treatment that's being offered, know the cost of that treatment, and know what the outcome will be. We're asking all dentists and dental care professionals to have effective complaints handling procedures. But there's also the principle of getting valid consent to treatment. That's very, very important.
The guidance, which takes effect on Monday the 30th of September 2013, comes as research shows that of those patients who have considered complaining about someone in the dental profession, almost 30% didn't know where to start, a quarter didn't know how to get the information they needed, and a fifth didn't believe their complaint would be investigated. Mapped out against the recent Francis report into the Mid-Staffordshire NHS Foundation Trust, the new standards put an emphasis on the culture and values of the dental profession. If a complaint is made about a dental professional, their behavioural conduct will be measured against the standards and guidance in this document. The GDC hopes that the inclusion of patient expectations reaffirms for dental professionals the importance of putting patients' interests first. It's hoped these principles will enable patients and dental professionals to foster much stronger relationships.
A good way of describing it is it's a new compact between the profession, the dental profession, and patients and the public, with clarity of expectation on both sides. I hope very much that dentists and dental care professionals will find it easier to apply high standards in practice, because they will have a clearer reference through the standards we're publishing. I hope also that patients and the public will have an increasing awareness of the kind of standards they can expect or ought to expect when they go along to a dental practice, and similarly that they feel they have a ready avenue for complaint in the very few circumstances where things go wrong.
For more information about the General Dental Council Standards Guidelines, go to gdc-uk.org.